It really doesn't matter how many sexual partners you have. You could just have one and still get this thing. It would be so great if this vaccine were just gotten as a matter of course, that you didn't even think about it. It was just something that everybody got.
Cancer is not, they say, women problems, or, it's vaginal cancer, it's cervical cancer. It's human cancer. It affects everybody, because it not only affects the people who have cancer. For instance, it not only affected me, it affected my 4-year-old little girl, it affected my family. It is human cancer. There's now showing that there's a direct correlation, between HPV and throat cancer, among all these other cancers. So it is affecting boys, it is affecting men.
I'm living in the moment, and I'm happy that I've been able to get through what I know has been a challenge for many, many women.
So right now your prognosis is good.
So far, there's always that worry in the back of your mind. Is this something that's going to recur? And it's something that we go through as cancer survivors. And I'm checked every 3 months, and always hoping for the best. But it's a new reality. It's a new normal for us.
I was never offered the Pap test. I was never, I actually didn't even know anything about cervical cancer. So to me, it was like, oh my God, I have cancer.
This is the same kind of prevention that you would want any child to have that's a vaccination. You don't want them to get the flu, so you give them the flu vaccine. And you allow your daughters to get Pap smears, which is a marker for sexual activity, and yet that doesn't come with the same stigma as the HPV vaccine. Yet they both are tackling the same topic and trying to prevent cancer from happening.
I was going through chemo and had to get a Procrit shot, and as many cancer patients know, that's to help your blood cells during chemo, which can rob and deplete them and lower your immunity. My insurance company refused to cover it. And, I called and asked, well, why? I mean, this is life-saving. This isn't, something that's unnecessary. And into the battle of why they won't cover it, the insurance agent, who knew me from nowhere, said, well, didn't you kind of deserve this, when I had to, explain what kind of cancer I had. And I'm almost never in a loss for words. But my jaw just dropped. And then I thought, who the hell are you to say that my cancer is deserved? And I deserve this suffering and the possibility that I might be leaving my son and my family. Who are you?
She battled cervical cancer for 5 years, and I know in that 5-year time, she often talked about wanting to tell her story. She wanted to talk about it, but when we came to LA, she was unable to really speak at that time. She's a very private, very reserved person. So as a family, we know that she had 3 small children and passed away at the age of 40. She fought to live, and we want to carry that on as much as we can. She always wanted to talk. She always wanted to make people aware, and we've since created she had initially done a Got Hope t-shirt, and we wore those last year to the conference. And this year, we have taken that on and done the Joe's Hope. So that something that stuck with Joe that she talked about often was what Dr. Felix last year mentioned. If the vaccine was out there and people were aware, this could be obsolete in 10 years. And she often shared that afterwards. And that's something that we want to carry on for her, is that get awareness out there, make it known. And with Joe's Hope, we want to do that.
What makes me come back to the National Cervical Cancer Coalition is the fact that when I was diagnosed, they were the first people that I talked to. They were the first people that I came upon, and I felt like I could get information and support in the same place on a very real, tangible, understandable level. And so every time they call and they say, Bays, will you come back and share your story? I'm like, of course I will, because you guys were the source of support for me when I needed it.